So this is a story that kind of comes out of nowhere, and it's obviously concerning. A growing number of non-smokers who are healthy and active end up getting lung cancer. That's what the data is beginning to show, and especially women. And this is later stage lung cancer. So we thought we'd try to shed a little light on this. Shirley Quach is a registered respiratory therapist, director of person-centered care and programs at the Lung Health Foundation, and is on the line. Thanks so much for being here. It's difficult, of course, for people to look at a headline like this and think, well, wait a sec, why would this be happening? So what do we know, and are we able to pinpoint why this is happening?
Hi, thank you for having me on the show. So if we're talking about some of the risk factors, we have some hypotheses, so some guess as to why people who has never actually smoked may have a risk for developing lung cancer.
Okay.
And so there are a couple of different ones. So just to quickly go over it, for example, radon gas. So radon gas is one of those gas that is in the environment. It has no smell, has no taste, no color. It's naturally broken down in the environment, and it accumulates in homes and buildings over time. Another one that we've been talking about more recently is about air pollution. So fine particulate matter from traffic industry, and over the last couple of years, we've really seen it with the wildfire smoke.
Okay. What else?
So occupational exposures can be another one. So individuals who work with asbestos, diesel exhaust, arsenic, certain metals, they particularly have a higher risk in that industry. Again, it has to do with the air quality of the environment that they're working in. Also, secondhand smoke, even occasional exposure can cause a increased risk for developing lung cancer.
So my question is, as I hear you go through the factors here, we've known all this stuff, it would seem to me, for the longest time. Asbestos is something we've known about for the last 50 years. I know radon gas now. There's a way to detect radon gas. Are we only now beginning to understand that these sorts of exposures are causing this lung cancer?
So it's really hard to pinpoint which exact one is causing lung cancer, but again, it's a multitude of different factors that can contribute to the development of lung cancer. So we talked about the radon gas, the air pollution, the occupational exposures, secondhand smoke, so things in the environment. But we also have to remember that there are other factors. So for example, biological and genetic mutations in one's body. So for example, molecular changes at the cellular level. So people who have a family history of lung cancer may have an increased risk for lung cancer.
Oh, okay. Is there, with respect to the figure that I mentioned off the top, that women are more likely or are getting this more than men? What's the explanation there? Is there one?
So we have some hypotheses or some guesses as to why that might be the case. So one of these hypotheses or guesses that with the hormones, right? So we've known that particularly that estrogen could be a risk factor. It could accelerate epidermal growth factor receptor as some of these cell biomarkers that can increase their risk for lung cancer or any cancer development. And then some other potential reasons, again, these are all guesses, we're not certain exactly as to why, some of the other mentioned environmental factors that we talked about, but also the possibility of air quality and pollution within where they're working, but also traditionally women have been cooking, so possibility to cooking fumes may be a potential reason, another risk factor to add to that list.
And for the women who are in fact the ones diagnosed with this, I mean, is this treatable? Is it, because I mentioned later stage cancer, I mean, how serious is it once that is something that's diagnosed? Yeah,
so here's the thing about lung cancer is that there's signs and symptoms. Sometimes you don't have any signs and symptoms in the early stages. It's really about screening and checking and getting appropriate screening and diagnosing in the early stages, especially if you know you have these increased risk factor. Now, it's once you identify that you're in the later stages of lung cancer, especially at stage 4, treatment options at that point are quite limited. So this is usually where the case where it's difficult, right? So we really encourage that people who know that they have these risk factors to really have this conversation with their healthcare providers, their family physicians, so they can figure out what is the next best step, whether it being going to a lung cancer screening program, being referred to a center, a cancer center, or to a thoracic surgeon for further investigation.
So that being the case, then, if you have it in your family, right, if it's hereditary, you want to go ahead and check as quickly, obviously, as you can, because you mentioned that as a potential risk factor. If at the same time, though, you've not had any other sort of warnings that you might have something, what can you do or should you do to just make yourself feel, comfortable that you've done whatever you need to do to make sure that you're not dealing with it?
Yeah, so this goes back to some of the risk factors that we had discussed, right? So, for example, the radon gas, there's no known safe level of how much radon exposure is okay, and it's really hard to pinpoint that exact number. So that's why it's very important to have a radon testing kit to ensure that you're testing for radon exposure in your homes, and also so that you can address that if there's high levels of radon. In terms of air pollution, we talk about wildfire, right? Over the last couple of years, we've seen more and more air pollution from not only traffic, industry, but also wildfires. So on days with poor air quality, it's important to wear a mask or stay indoors if that's possible. In terms of the occupational exposures that we spoke about as well, PPE, which is personal protective equipment. So wearing an N95, their respirators, those are also important tools that we can use to kind of reduce the risk for exposing ourselves to these environmental factors.
All right. I thank you so much for the time this afternoon. Really appreciate it.
Thank you so much.
Okay. So there you go. Again, a reason to be concerned, obviously, especially if you're a woman here. Shirley Quach is our guest name. Look, with respect to this radon gas, and I know this became an issue, I think, for people right in homes. But yeah, you can get tested if there's some concern. But of course, the question then becomes, if you can't smell it, if it's not detectable, why would you even begin to worry about it, even though you know that it's potentially very, very dangerous? So maybe just get that done, I guess, for peace of mind more than any other reason, whether you think there's a problem or not. But as she said, radon gas was the first thing she mentioned. I'm like, oh, okay. I mean, we knew about asbestos, we knew about mold and all that kind of stuff. But this radon gas issue, which again, as I said, was raised a long time ago and then I think completely forgotten. That's something you might want to consider. And then the other part, again, if it's in the family, if someone in your family has had it, that's a risk as well. So there's the warning for when you should get tested and actually make sure that it's not going to be a problem going forward.